My name is Ada Dominguez. I'm one of the nursing students here at FIU. I'm going to be doing head, face, neck, and lymphatic assessment. I'm going to use this head sanitizer to wash my hands.
Okay.
I'm going to check your armband. What is your name?
Alfredo Wilson.
Okay, very good. I see that you're Alfredo Wilson. Thank you so much. I'm going to start with your head and face. I'm going to note the size and shape of your head. And I see that it's normal cephalic, which is round and it's in proportion with your body size. I am going to feel your temporal artery, and I feel that it's normal and regular, and it's smooth, and it's non-tender. In the event that I would feel like sandpaper, I will auscultate and I will listen for bruit. I'm going to inspect your face for symmetry, and I'm going to ask you to smile. Okay, very good. I see that there's no presence of involuntary muscle, and the color of your face is well distributed, and the skin is nice, moist, and is intact. The expression is symmetrical. I see no edema. I see no lesions on your face. I see that your head, the scalp, there's well distributed. There's no lumps or tenderness or no lesions. Okay, I'm going to assess your eyes right now. And I'm going to, the first test I'm going to do is a Snelling test. So I'm going to ask you to cover one of your eyes with this piece of paper if you want. Okay, cover the eye, and I'm going to ask you to read a letter here.
Okay.
All right, I'm going to ask you to do the same on the left side to read a letter. And this tells me actually the acuity of your eyes. Okay, that's asking for acuity, visual acuity. Okay. Now I am going to do the cardinal signs. Okay, I want to focus on this object. I want you to follow this with your eyes. Okay, very good. Very good. Very good. Very good. All right, I see there's no nystagmus in the eye. Okay, and I'm also going to see the cornea light reflex. Okay, I am going to shine the flashlight on your eye, and I see that it reacts to light and it constricts. Okay, I'm also going to do, this is the direct, and I'm going to do consensual. Consensual, I'm going to look at this eye, and I'm going to make sure that also this one constricts. All right, so I see that it's normal, and I don't see any difficulty at all. All right, moving right along, I'm going to assess the internal and the external ocular structure. All right, of your, can I ask you to open and close your eyes completely? Okay, I see that the skin is intact without redness or swelling. Your eyelashes, I see that they're evenly distributed along the lids and no lesion present. The conjunctiva is pink and moist, and there's no swelling. All right, the sclera is white, and there's no cloudiness on the cornea or the lens of the eyes. Okay, I'm going to assess for any papillary response. Okay, I'm going to ask you to look at the eye, okay, at the light, okay, and I see that they're reactive, right, and they constrict. So I'm checking for product. That is fine. All right, I'm going to do the accommodation test. And the way I'm going to do the accommodation test, I want you to focus on this, and I'm going to move this forward towards you. Okay, I see that both eyes constrict, which is a normal sign. All right, and everything appears to be normal. Okay, now I'm going to assess your neck. Okay, and I see that the head, I see that the head is in the midline and the neck muscle are symmetrical. Can you please flex, extend, and move the head to the right and to the left? And I see that you have adequate range of motion. I'm going to assess the trachea that is midline and it's in the suprasternal notch. Okay? Now I'm going to assess your lymph nodes for any swelling. Okay? We're going to start here with the first one, which is the preocular. It's right in front of your ear. Then I'm going to do the posterior auricular, which is superficial to the mastoid process. I'm going to move back, and this is your occipital. I'm going to come back to the front right here, and this is the submental. It's right behind the tip of the mandible. Then I'm going to go here to the side, and we have the submandibular, okay? And we're going to go right around here, and I'm going to feel the jugulodisgastric. It's under the angle of the mandibular. Then we're going to go to the superficial cervical, a little bit over here, which is overlying the sternomastoid muscle. Then I'm going to go a little bit lower, which is the deep cervical. It's the under the sternomastoid muscle. And then I'm going to go right over here in the clavicle, right here. And this is the posterior cervical, all right, which is on in the posterior triangle along the edge of the trapeze muscle. Then I'm going to come here, right over here, and this is the supraclavicular, and it's above and behind the clavicle at the sternomastoid muscle. Appears to be normal on both sides. Okay, then I'm going to ask you for the salivary gland. Open your tongue, up. Okay, I see that there's no enlargement. Now I'm going to assess for your thyroid. So I'm going to see if you can turn so I can assess. It'll be easier for me to do this assessment. Okay, I am going to ask you to please move your head forward and to your right. And I'm going to push your thyroid in the direction that you're turning and palpate. I'm going to ask you to swallow. Beautiful. I'm going to do the same thing on the other side, and I'm going to push in the direction that you're moving your head. I'm going to ask you for swallow. Beautiful. Okay, I feel no lobe enlargement, no goiter. Okay, Alfredo, can you turn this way, please? We have completed the assessment, and now I ask you if you have any questions, any concern that I could address.
No, thank you. Okay.
All right, thank you so much. You've been an awesome